Sarah Loss joins us from Windsor Laurelwood today, and we're going to talk about something that's, well, it's pretty important. A lot of people don't realize it's going on around us, but substance abuse is still a big problem, and you're here to help.
Of course. Thanks for having us. Yes, we are here to help, and we've been around for over 123 years. We're the longest running addiction clinic in Northeast Ohio, and we're here to serve the people. We have served, adults, kids, substance use. If you have a mental health diagnosis, we are here to treat you. We treat patients with, depression, anxiety, schizophrenia, bipolar disease, but, as important as it is, especially in today's world, substance use too.
Yeah, I imagine there's a lot of different substances to abuse. How does a person come to the reality that, yeah, I'm in an abuse stage right now and I need some help?
Mm-hmm, mm-hmm. So really, anytime it's negatively interacting with, your personal environment, your social relationships, your professional relationships, generally it's somebody that, spends most of their time thinking about this substance. Their life really revolves around this substance, unfortunately. Or it's just those people that, maybe drink a few too many each night and notice that they're using it to cope. Recently, we had a business owner who fell on hard times during COVID, and they noticed that they were using alcohol as a coping mechanism. They wanted to use more healthy coping mechanisms because they came in to help us. But yes, like you said, lots of different substances out there to abuse. We treat everything from alcohol abuse, opioid, heroin, fentanyl, cocaine. There's things out there like kratom and bath salts and really anything you could think of.
Yeah, so I think it's a great thing to talk about and think about because, you think about drug abuse, you think about, you see what you see in the movies is somebody like falling down really out of it, but it could be like a right on the border there that's really affecting their lives. And I imagine a detox situation comes into play then.
Yes. So that's one of our primary focuses is to detox patients off of these substances. So that's when somebody's been using chronically, they want to stop, but maybe they're not sure how to, or maybe they're scared to. So they come in, we detox them, give them medications to be more comfortable with that, and make sure that they don't have any, medical complications with that. Detox can be really scary. Some people can have, seizures or medical complications, and we make sure that doesn't happen. That's one of our main things.
Is this just a young person problem, or could this be a middle-aged or even an elderly person's problem?
Yeah, that's one of the really sad things about substance use is that it does hit every age, every socioeconomic class across the spectrum. I mean, you and I probably know, a handful of people suffering with substance abuse right now, even if we don't even realize it. We see people from 18 all the way up to, we've had people in their 80s, and it takes every single walk of life. We've had CEOs, we've had people struggling with homelessness, we've had grandmothers, we've had, young college children. Really, anybody can suffer.
Yeah, so it's an every person kind of problem and can be. So where do they come in? How do they get involved, and how do they get this help that you've been providing for over 100 years?
So we do have a phenomenal intake department. You can call our line. It's 1-800-GET-HOPE, and you can get a no-cost assessment there. The nice thing about that is that you can walk in, you can call the line, or we can do a telemedicine through, a computer or Zoom if you'd like that. And the nice thing about that is that they can help you set you up with any help that you need. We have inpatient detox, we have rehabilitation, and we also have outpatient. And you tell them what you're experiencing, and they work with you to try to figure out what's best to help treat your diagnoses.
It's Windsor Laurelwood. So if you think you have a problem, or maybe just wondering if you have a problem, this is the place to go. It's a safe place to go, and they can certainly help you. And thank you, Sarah Loss, for your help today. Really appreciate it.
Of course. Thank you for having me.